Great. Well, it's really an honor to be here and to start the day really seeing the vaccine production facility, having it so close and down the road, and really looking at the speed at which they stood that up for the American people. And that was very exciting. But I have to say it was very reassuring to be here today. I know of the strong independence of Texans. We've driven from Amarillo all the way across from Dallas to Amarillo, and this time we've driven from New Mexico across to El Paso, up to Dallas, to Waco, to Austin, and now here, really experiencing the full extent of the state, from their oil to their cattle, to their farms, to their major metros, and now to their institution of higher education. And I just want to thank the president and his team for his leadership. We're used to the independence of Texans, but I think what I witnessed today from both the students and the faculty and, frankly, the community is a sense that independence linked to selfless respect for others leads to a spirit of community. We heard from the community that they were, how did they describe it? 2 cities, 1 community. And I think it set the tone that they were transcending any individual needs for the health and welfare of the greater goals of the community. I have to say this university has one of the lowest infection rates that we have seen. So I talked to the students and said, what are you doing that I can learn from? And they said from the beginning, the administration created the tone that the students would be responsible for the leadership and the responsibility needed to ensure that they could stay in school and ensure that infection rates remained low. And I think this sense of respect, selflessness, the students all parroted to me their deep understanding of who is most vulnerable to this virus, how to protect them, both those individuals that they have at home and the individuals in the community. There was no distance between how they viewed this community and how they viewed their own family and what they needed to do with their behaviors to ensure that the virus was not transmitted. The level of understanding of, we like to call it now, physical distancing with social interaction, so that people can understand that we can be together socially yet physically distant. The understanding of masks, the understanding of hand hygiene, but I think more than anything, this linking of their behaviors to their core fundamental values of this institution related to respect for others and selflessness. And you could see that in the way the students describe the peer pressure to really ensure consistent behavior and protection of others. And I think it's really inspirational to me today personally, in light that we're facing 200,000 Americans whose lives have been lost, to really hear the students lift us all up in the belief that we can pull together as one community, independent of our political backgrounds, to work together to respect others and to ensure that the virus does not pass to one another. And I think I was really deeply moved by both the administration and students and the community working together since March and April to realize this goal of maintaining the health and welfare of both the students and the community where they reside. And so that was really a terrific understanding. I saw a very deep collaboration between the university and the community. Of course, I always want more tests and more testing. So we talked about, how to expand testing both in the community and in the university. But I just wanted to leave you with that concept that sometimes this virus has brought out the best of us. And I really witnessed this today when people talked about selflessness and self-sacrificing for others and others' help. So I'll take questions.
Yes, ma'am. All right. Yes, ma'am. Can you identify who you're with?
I think it's building on the technical, scientific, and core values of the university to selfless service is what we can do for each other and protecting one another, but it also leads to scientific discovery and bench-to-bedside interventions, whether it's in agriculture or cattle or even in human sciences. And I think you see that that forward-leaning behavior of Texas A&M taking on vaccine development back with BARDA in 2012 and really providing this platform that could then be expanded. And so we're all working towards an effective vaccine. The two components that they're working on here are very much what we call our subunit vaccines. There's 3 different platforms we're working on. Two of them are messenger RNA. Those are in the most advanced studies, the Moderna and Pfizer. 2 of them are vectored expression systems of proteins, and one of those is AstraZeneca that will go into phase 3 trials shortly. And then the 2 subunit vaccines, and we all know what those vaccines are. That's like hepatitis B vaccine. Many of our vaccines that you have experience with are vaccines that have been specially created as subunits. And those will go into study later, and they're making right now the critical vaccine component to go into these phase 1, 2, and 3 trials in the United States. And so that has been very exciting. But I think it just really fits into, until we have a vaccine, I think really learning from the students and their leadership about how to protect one another. It's a message that we will take across the United States. We've been to 15 different universities, many of them SEC schools. We'll be heading to Auburn and Clemson later this week, really trying to compile for all of the institutions of higher education what is the secret sauce. And our secret sauce we've seen so far across all the universities that have been able to open and stay open is they spent the spring and summer working together, learning together, universities and communities linked together, understanding that success was both in their best interest to figure out how to bring students back to campus, and then learning as they did. Having students, I think the SEC bringing students back in the June-July timeframe and their student athletes really helped them to learn how to lay out things, how to do better testing, how to contact trace. And I think that partnership of contact tracing and testing and isolation and quarantine that we see here is very well advanced. But I've seen that in all of the universities. And I think universities that have planned for certain students would come down with the virus and plan that they would have to have isolation and quarantine space are the universities that have really together really inspired us to see that there's a path forward. But it all comes down to the students.
Okay. Kendall?
Well, I think it's complicated because it has 2 pieces of this. One, you have to prove that the vulnerable population with that particular vaccine, it's immunogenic and safe. And so all of these trials have a broad age range to really get data about safety across age ranges and immunogenicity. So that will be absolutely key, because the vaccine has to match the need. And so we all know, and I was really impressed by the students here who clearly knew who was most vulnerable to a serious outcome. And that is individuals with comorbidities no matter what the age. And so we have some very young people with significant comorbidities, and we have to really have respect for that and understand that. But we certainly know well-defined, and the CDC's done a great job of defining that category for us. And so the majority of the people who succumbed to this, of our 200,000 Americans that we have lost, 94% of them had comorbidities that put them at risk. And so I think the real question is, we obviously want to vaccinate those individuals as fast as we can to protect them from this virus. And so, but we need to have a vaccine that is efficacious and safe in that group. And so that's really what will determine when they will be immunized.
Kenny?
Dr. Birx and Kenny Wiley from the Environmental Station newspaper. Building on the two questions that have been asked, help us understand, if you would, about distribution timelines. We've seen different projections in the news. Your understanding of where we might be looking at what 2021, what we know now, what it could look like with regard to distribution, and how what you saw today.
So two things. One, the trials are enrolling. Many individuals in these first two trials have gotten their second shots. And once they get their second shot, 2 weeks later, you can start counting. So clearly, we now already have individuals that are in that window when we can start determining efficacy. So we have finally entered that window, that efficacy determination window. So that, obviously, the trials ramped up over time. So we have the least number at the beginning that are in that window, and that ramps up rapidly over the next several weeks. So we know we'll have people in that counting window. What I don't know is if there's virus in the communities where those individuals are that got vaccinated. And obviously we've vaccinated, the NIH has worked with these companies to really vaccinate broadly across the United States. And so that really determines the efficacy. The second part of your question is, will we have vaccine? And that's a great question because right now we're manufacturing. So all of these products, all 6 of them, are undergoing, and some of them just up the street, manufacturing at risk to have a safe product available once we show safety and efficacy. And what do I mean by safe? You know, a product that isn't contaminated, is clearly made and manufactured according to good manufacturing practices. So that's happening simultaneously. And I think the question is, how many of these vaccines will work? And that determines how many doses we have. And so that is really the question right now. We have on paper enough vaccine to immunize everyone. The question is, will all 6 candidates work? Some of these candidates are quite, I won't say easy. I should never say that. They're all, I mean, they really have highly technical people working on this around the clock. So some of them can produce a lot quickly, and some of them produce a certain other amount per month. And so that will really, it totally depends on not only is the product safe and efficacious. So we're counting now. Outcomes matter now. How quickly we get that answer, and then how many doses we have will determine, and what population they're immunogenic in. So it's really, that's why people keep hedging, because although we have enough, we have to decide if it works, and if it works in those specific age groups.
We'll get to you next, sir. I want to get to one live stream question from Brittany Brito at the Houston Chronicle. How are Texas colleges faring as a whole in regards to continuing operations during the pandemic? And are there colleges in Texas or out of state that U.S. colleges should look to as examples of how to operate during the pandemic?
Well, the great thing about being to 15 different universities, and I just want to call out, these universities have they all had that secret sauce of planning over the summer, working actively with faculty, students, and community to have that joint buy-in. All of them had plans for testing and student isolation and quarantine. But each of them has something unique that I think we can all learn from. And that's the important part of going from university to university. So here we saw a value system that really created in students that sense of selflessness and respect for others that we think is really critical for student behavior. In other universities, we've seen really elaborate but really important plans on which they haven't had to use as much here because they've had less students in isolation because they have less infection. But really great planning around how do we support that student's mental health? How do we support them academically? How do we support them with food? How do we support them with medication that they may need? So each university has something that I think is innovative and a breakthrough for other universities. So when we get back from this trip, we'll be writing up all of our findings from the then 17 or 18 universities to share them with other universities that went totally online this fall, so that they can start planning right now for potential to be open in the spring. And that was really the point of this trip. We are seeing all of the rates in universities declining. Each of them had a different peak. Each of them had a different percent positivity. And each of them, but all of them are moving through, we think, a significant number of students that had the most risky behavior were infected early, and the other students that were highly compliant, we hope will not become infected. And so we see the values, whether we are at Baylor or whether we're at University of Mississippi or University of Alabama, we see that by week 4, 5, and 6, the rate and the test positivity of cases is going down dramatically.
I know you've got to get on the road soon, but sir, we'll call on you, and then we've got somebody back here, I think, that had a question.
Great.
My name is Scott from Ryan Broadcasting. Based on what you see today, if there ended up being a vaccine, the efficacy rate was significantly higher than anything you've seen. How would that change what's going on in college?
Well, I think it would give the community the confidence if we had a vaccine. Right now, I know a lot of individuals in the community are doing exactly what they need to do if they're in that vulnerable category and protecting themselves. And I think you can see that in the lower hospitalization rates here. And I just want to call out the community as well as the students for really following the mask guidelines, the physical distancing but socially aware, really understanding that neighborhood parties and parties with family members that may have traveled in are dangerous. That's where we're seeing transmission occur most of the time. I know many of you read the CDC's MMWR, and they put the one out about risk in different situations. The biggest risk was family and local neighborhood gatherings. And so really understanding that if we take our mask off because we're eating and we're close to people, you cannot tell if they are asymptomatically infected. And that's where no one is intentionally transmitting the virus. It's that this happens in these asymptomatic places. And so once we have a vaccine that we know protects the vulnerable and the healthcare workers, then I do think it's important for it to have access in these communities where you have vulnerable individuals in these college campuses. College students, on the other hand, because of their less risk for serious illness in general, unless they're in that vulnerable category, may be on that tail end of immunizations. And so presidents, and we talked about this, really need to plan for their spring semester to look similar to their fall semester and understand that vaccine may not get to college students until late in the spring.
Thank you. Yes, ma'am.
You know, that is a great question, because many of our university students have a very difficult time in flu season, and we see a lot of flu transmission. So we certainly want people to get their flu vaccine. But what we've seen across the southern hemisphere is what we've been doing together to prevent COVID transmission is also resulting, at least in the southern hemisphere, less flu transmission. And so now that we have this capacity, we're going to have to decide when there are respiratory illnesses and they're on campus, do we go back to some of these well-learned techniques that we know protect one another from respiratory diseases? And I think that is a really open question. I think we've learned how effective telemedicine is. We've learned how effective Zoom can be. Not everyone loves it. And, you know, I do worry about differences in social and auditory and visual learners and really making sure that we're meeting all of their needs. So I'm sure there are things we will take away from this, but I tell you what I will take away from this today is really being inspired by the administration and the staff here, and critically the students and the community, standing together and saying, you all as a community is worth my personal sacrifice to physically distance, wear a mask, and ensure good hand hygiene. And I think as Americans, when 18 to 22-year-olds can do that, it tells me that we can all do that. And that peer relationship that's driving that behavior. I asked the students, I said, why are you being so good about these behaviors? And they said, because the faculty empowered us to lead. And I think that really tells us that how important empowering others to lead, give them the information, and then empower them to lead. And I think that's been really inspirational in this trip.
Well,
thank you
so much.
Good to see all of you. Good to see all the maroon. I think they told me to say howdy, but I'm doing that just for the students, because they have so much respect for them. So howdy to all of the Texas A&M students. Thank you for what you're doing. Keep it up. We'll make it to Thanksgiving together.
Thank you.